Hello everyone, this is Dr. Demchenko, a sports doctor, osteopath. Today we are talking to you again about the knee joint. And we will talk about the patellofemoral joint. This is a joint between the kneecap and the thigh bone.
Well, the thigh bone.
This is essentially our kneecap. Very often under high loads on the quadriceps, and in rollerblading the quadriceps is very strongly activated, the load on it is very large. It shortens and pulls this dry joint. As you can see, the cup is practically mounted in it. When it pulls strongly for this dry joint, the cup begins to press very strongly to the joint and there arises increased friction. Nothing good. There will be inflammation, swelling, and pain. How to deal with this? If you have pain in the front part of the knee joints, that is, if you take, like this, the front half, then 80% of these pains are associated with the cup and the quadriceps. Most often with the fact that it is clamped, shortened, or just weak. In the previous video, we demonstrated how to correctly stretch the quadriceps. Today, I wanted to show you what you could do with your own hands, with your knee and quadriceps. First, the quadriceps, besides stretching, can be massaged. Moreover, self-massage of the quadriceps can be very effective if done accurately. The main point for relaxing the quadriceps is located in the following place. If you take the kneecap, it has 10 corners. These you can always feel. And from this corner, go up the thigh about 5 to 7 or 10 centimeters, depending on how long your thigh is. Start feeling the points along this line. If you have problems with the tension of the outer head of the quadriceps, along this line you will find a very painful point. Well, here it is for me. When you find this painful point, you can just insert your big finger quite intensively and start kneading it with small circles. It should hurt, unfortunately. No pain, no gain. Accordingly, after 1.5 to 2 minutes of kneading, the point will stop hurting. Now, in my practice, there were very frequent cases when a person comes with severe pain in the knee joint, bends poorly, lies down. We massage 1.5 minutes point, one bending, unbending, quite an intense click occurs. Why does the click occur? Because, for example, the cup was tilted due to the imbalance of the muscles. After we massaged the muscle, it stopped pulling the cup strongly. The cup with a click fits into the right place, and the pain in the knee becomes sharply less or even goes away. Let me repeat, we go to the outermost corner. We go up 5, 7, or 10 meters from your thigh and look for a painful point. This is the first point that I would like to knead. The second point is on the middle line. We take the thigh, the middle line, and start feeling along the middle line. Painful points can be found practically anywhere. For example, I have a very pronounced painful point here. This is the direct head of the quadriceps, which is responsible for the height of the cup stand. A very important head. There can be multiple such painful points. Very often they are close to the buttocks, very often they are somewhere just like the lower third in the buttocks, and all these points need to be massaged very well, about 40 seconds or a minute until they stop hurting. This can firstly help you greatly alleviate the stretch, and secondly, it can help you with pains inside the knee joint. The diseased points on the inside are encountered more often because of the outer head of the quadriceps. The outer part is often overloaded and clamped. The inner part, on the contrary, is often weak and underworked. Therefore, diseased points here are very rare. Therefore, we only look for them here if you have some pain in this area. You can just not look for them. There are two main lines, the middle and the outer, along the kneecap. The next technique will be directly related to the movement of the kneecap. For this, I will slightly undress, show you my knee. It will be easier to find the bearings. So here is the kneecap. And we need to make it move well, wear less. To do this, it needs to be moved in a certain way. For this, we sit on a stool, make the angle slightly more than 90 degrees. Then we put it with 2 thumbs. 2 fingers on the edge of the kneecap from above, and we lower it down. That is, we are essentially making such a movement If you do it correctly, what should happen? First, we move the cup, not the skin. That is, if you move the skin, you will directly see that your skin is moving, but at the same time, the cup stays in place and nothing comes out under the cup. If you move the cup correctly, first of all, you can see how the cup itself moves down. And secondly, a very correct sign, there is such a fatty body under the cup, and this fatty body slightly comes out in different directions. This indicates you're performing the procedure properly. Also, if you're doing it correctly, you'll feel some muscle stretch on your thigh. We're not doing this to stretch the thigh. We're doing this to, first of all, stretch the lateral stabilizers. Those lateral links that are on the sides from the knee, we stretch them, and to improve the very sliding. So it will be better to squat and better to slide. When will we do such procedures? First, if you have pain under the knee, under the cup, or above the cup, that is, in this area there are some unpleasant pains. We will do this if you have stiffness in the knee in the morning. That is, the person says, I need to spend the first 5-10 minutes. That is, instead of walking around, you can sit in the morning, do about 30 times, and it will not be necessary, in principle, a sufficiently useful event. So if you, in principle, a sufficiently useful event. Therefore, if you, in principle, experience large loads on the knee joint, then you can once a day in the form of prevention, even at work, put your fingers and slightly move the cup. This will improve the condition of your knee. After such a procedure, I hope you won't need this knowledge. After such a procedure, I hope you won't need this knowledge, then tell your friends. But if you have knee pain, you will be able to help yourself. Thank you all for your attention. This was Dr. Demchenko. Subscribe to the channel. Wait for the next releases. Bye, everyone.